Hello, I'd like to introduce you to our group presentation on person-centred care and McCormick and McCance's person-centred framework, with our emphasis being on the care environment. According to the World Health Organization, a definition of person-centred care is an approach to care that continuously adapts the perspectives of individuals, families, and communities, that sees them as participants to a holistic approach that supports decisions and participation in their own care. Well, that's their definition, but what does it mean to you? Well, this is what it means to us. Well, person-centred care to us means to treat every person as an individual for their own uniqueness, personality, history, and cultural and social views. To us, it means more to always embody respect and professionalism for each person, whether it is patients or our colleagues. Always following the nursing code of conduct and providing the highest quality of care is something we should always strive to achieve. So how does McCormick and McCance's person-centred framework and the care environment factor into this? Well, it consists of 7 key areas. An appropriate skill mix is an emphasis on working with a range of staff who possess the requisite knowledge and skills to provide quality patient care. I'm sure you wouldn't want to have a graduate nurse looking after a critically ill patient, or a hospital not having enough registered nurses to effectively collaborate and plan. It's important to have the best appropriate staff available to effectively manage and work within the multidisciplinary team. Systems that facilitate shared decision-making implies an inclusive environment in which to be able to communicate and form a holistic approach. A system that provides staff to be engaged in and pursue continued engagement and decision-making within a team. Nursing staff working alongside physiotherapists to provide key care at appropriate times and assessment data to assist in better mobilising a patient. Effective staff relationships mean not only working with our patients, but how we work together as a team. An environment that is free from judgment and promotes professionalism only serves to better affect the outcome of the care given to the patient. The staff are only as good as the system they work alongside. Nursing staff can't effectively provide care for their patients if the environment in which they work is disorganised. Supporting organisational systems that provide professional development and professional accountability allow for higher staff satisfaction and allow for higher staff retention. For example, a review on Australian healthcare programs by the Department of Health showed that magnet hospitals, particularly the Princess Alexandria Hospital, had a 15% reduction in staff turnover after implementation of a system that has supporting structures and care. The sharing of power means to allow the patient and other members of the multidisciplinary team to actively facilitate changes in a patient's care. Having this increase in participation from the patient in forming a care plan that is better suited for the patient is a practice not traditionally implemented in healthcare. It's an emerging concept brought about by the person-centred framework. Potential for innovation and risk-taking accounts for the ability to be able to use the best available research, evidence, patient preference, and local information to provide the best outcome for the patient. The best use of information and autonomy for the nursing staff allows for the shared integration of information, practice, and decision-making. Each patient is different. What is right for Mr. Smith may not always be appropriate for Mrs. Jones. The physical environment. It's the obvious aspect of the care environment. While traditionally it relies on clinical efficiency, the area is itself clinical, drab, depressing, and soulless. But does it have to be like this? The Lady Cilento Children's Hospital utilises colour and fun in a style that aims to draw attention away from an unfortunate set of circumstances while aiming to provide fun and energy. This is a great example of how the physical environment can have a positive effect on the outcome of a patient's care while in the hospital.
The components of the care environment are necessary in providing care that is person-centred. It's in the delivery of the care that leadership challenges may arise. So what challenges could you encounter in a healthcare environment?
It could be said that identifying and developing nurse leaders is one of the greatest challenges faced in the nursing career. Nursing is an exciting and thought-provoking profession, which requires inspirational, engaging, and motivated role models and leaders. It is imperative that these individuals are developed as leaders to promote healthy and positive energy to all staff. It is important to avoid fostering people who are not suited to leadership positions. Key research conducted by Stephanie Connors suggests that it is often the more confident, louder, and negative professional who is given more influence and leadership opportunities than the quieter and more positive person. The research showed that it were these leaders who had an overall negative effect on their team, as they were often disorganized, inconsistent, and provided little follow-through with their actions. Because someone exudes self-assurance and character does not necessarily make him or her a better leader. It is this research that presents the idea that we should be aware of the negative leader phenomenon. As Connor quotes, "An organization that fails to develop its quiet leaders is apt to be left with negative, informal leaders who, while vocal, produce little." Strong nurse leaders should inspire their fellow nurses and exceed their leadership expectations. They will follow person-centered care by treating everyone with respect, putting their patients' needs first, and following ethical principles. These leaders should be respectful and positive when being authoritative, and by following leadership this way, it is less likely they will have to reprimand, and staff will naturally follow their lead. It is inevitable that at times communication breakdowns and conflict will arise. Strong leadership from nurses can prevent these conflicts from intensifying and in threatening the patient's well-being or permanently hindering the team's operative work ability. Increases in nursing communication can reduce medical errors and make a difference in positive patient outcomes. In a 2014 study issued by the New England Journal of Medicine, medical error rates in 9 children's hospitals decreased by 23% after a handoff program was instituted to enhance and standardize communication. According to Ross Wright, the body of literature in nursing communication points to increased recovery rates, a sense of safety and protection, improved levels of patient satisfaction, and greater adherence to treatment options, as well-documented results of effective communication. To be a successful nurse, exceptional communication skills are required. The ability to communicate and bond with patients and your healthcare professionals will help build relationships, prevent errors, and provide a higher level of person-centered care.
Before we introduce our next part, we advise that a sensitive topic is about to be discussed. It is with deep respect and consideration to those affected by infant loss that we aim to present a dignified and benevolent initiative that was made to honour and celebrate the lives of those who have been lost. Imagine experiencing stillbirth and having to lay in a maternity ward surrounded by pregnant and labouring women and listening to the joyful sounds of new parents and siblings cooing over their new babies and the sound of those babies crying. Imagine how compounded that grief would be, exacerbated by the lack of privacy and exposure to traumatic noises and situations. This has been the experience of countless families, and finally people are doing something about it. A particularly poignant innovation within the healthcare industry is the provision of bereavement rooms in many hospitals. While these rooms exist in many different parts of hospitals, in this presentation, we're specifically talking about the maternity ward. Bereavement suites, which are often called something non-threatening, like butterfly or daisy rooms, are special rooms where parents can grieve with their stillborn or dying baby. These rooms are very private and carefully decorated safe havens where mothers and fathers, and if so desired, siblings, grandparents, aunts, uncles, and close friends, can gather to bond with and celebrate the life of a baby who has or will pass away. As recently as the 60s and 70s, stillborn babies were taken from their parents immediately to the morgue, as it was believed that seeing and holding the baby would make the healing process harder and longer, or that there was no need for a grieving process. Most parents never even knew where their babies were buried. Although this attitude and the events of those times are not talked about and are barely acknowledged, studies show that in order to facilitate a healthy grieving process, parents need to bond with, name, dress, talk to, take photos, and cuddle their babies in order to gain closure and validation for their immeasurable grief. With the provision of cuddle cots, which is a specially designed cot made to preserve a body, parents also have as much time as they need in a supported, comforting environment to say goodbye to their baby. Bereavement rooms are an environmental innovation which has improved postpartum care on a holistic level. The rooms are usually painted soft colours and well-known images are avoided so as not to compound future grief if the image is re-encountered elsewhere. Beds, armchairs and couches are provided so the parents can sleep and cuddle together with their lost child and with their other children for as long as they need. Many cultures are very inclusive of extended families in the grieving process following the death of a member. Therefore, enough room for multiple adults and children is included where possible. There are provisions for music to be played, and many hospitals have photographers who will attend day or night free of charge to take family photos. The suites are usually situated away from areas expectant and new parents frequent, or if this isn't possible, they are soundproofed to keep the noise of crying babies out. The suites are often self-contained with en-suites and kitchenettes to ensure complete privacy and protection for fragile parents from outside disruptions. Where available, special bereavement care teams are assigned to provide support to the family. This ensures the best quality of care through an appropriate skill mix and minimises the risk of negative experiences. Additionally, having their own private room which they can use as they please enables parents to feel empowered and encouraged to ask for the things that they need as they feel prioritised and valued. Nurses are also encouraged to provide mementos for the parents and to allow and help them to decorate the space to support the ritualistic practices of many families. The suites enable person-centred care, which is care based on what the person needs, not based on what the hospital deems necessary or appropriate. This is holistic care, completely focused on the mother and father's spiritual and emotional needs, instead of only medical, symptomatic treatment of tremendous human loss. Wounds from childbirth heal, but the wounds from losing a child never fully heal. Therefore, so much more attention and care must be paid to the psychological wellness of grieving parents. These suites offer the protective and nurturing environment that people need as they experience life and death in the same hours and transition beyond the expected.